The Neuropsychiatry Center, as led by Dr. Robert Ronis, is recognized internationally for its significant research and treatment of bipolar disorder across the lifespan, from pediatric to geriatric. Additionally, our nationally recognized experts address the issue of co-occurring disorders in both adult and pediatric patients of the Neurological Institute.
As you might imagine, most medical conditions, certainly in general, but specifically many of the neurologic conditions, have co-occurring psychiatric syndromes, and that may range from adjustment disorders, from depression or anxiety related to a primary medical illness, to actually an underlying mood disorder or anxiety disorder that might have been previously unrecognized or untreated. The Department of Psychiatry here at University Hospitals has a number of areas where we're recognized nationally. The Mood Disorders Program actually has the first National Institute of Mental Health sponsored bipolar center in the country. And then in our child and adolescent program, we've gone from having a very small division to one of the largest divisions of child psychiatry in the country, and one of the leading researchers in bipolar disorder, attention deficit disorder, conduct disorders and behavioral disorders of kids, and a whole range of serious mental illnesses in children. Psychiatry is interwoven throughout the Institute into all of the various centers. So we have a permanent presence with a physician working with memory and cognition. We have a psychiatrist working with the Epilepsy Center, working with the Child Neurology Program and many of the other centers.
The center offers such innovative treatments as electroconvulsive therapy, transcranial magnetic stimulation, and vagus nerve stimulation.
For VNS, a surgeon, usually a neurosurgeon, will implant very superficially an electrode in the vagus nerve, which runs through the neck. It's a very small, minor procedure, only takes a few minutes, and the patients are in and out in the same day. And a pacemaker of sorts is implanted that can then be adjusted by the psychiatrist or neurologist. And with some adjustments of the vagus nerve stimulator, we're seeing interesting improvements in very serious depressions that have not responded to other kinds of treatments.
Significantly different than in the early years of its use, ECT today is a very benign, medically safe, and highly effective treatment that is performed while the patient is anesthetized and with no convulsions or other negative side effects.
So we know that most of our medicines have about a 60 to 70% efficacy rate. They're going to work for 60 to 70% of the people that we might give them to. ECT has a rate that's closer to 90% of success, particularly in the more difficult to treat depressions, sometimes an obsessive compulsive disorder, and some of the more severe psychiatric syndromes.
Additionally, the center provides comprehensive neuropsychiatric counseling to the other Neurological Institute centers in cases where there might be a psychiatric component to the patient's disorder. The center also offers a full range of evaluation, rehabilitation, and treatment services, both ambulatory and outpatient, for addiction recovery. The center's programs extend across our health system, including medical centers and ambulatory sites.
I think what's different about the Neurological Institute is it's part of the fabric of the entire organization. The psychiatrist isn't kind of called in as the outside consultant who gives an opinion and then goes back home to their psychiatry department. The psychiatrist is an ongoing part of the care that's available and accessible.